I'm with Aging Well Durham. I'm also the community based organization representative, and I co-chair this committee along with Brittany Price. So while we're waiting, if I'm going to invite the committee members to please introduce yourselves. We're still getting to know everyone's names and also organizations. So I'm going to just go straight across the screen. If everyone could introduce yourself and then pass it to someone else. So I'll start with Brittany. You're muted, Brittany.
Sorry about that. Hey, everybody. I'm Brittany Price. I'm a co-chair of the OSAC. I am in the healthcare payer slash funder seat because I work as an evaluator on several national funding opportunities, and I also do technical assistance for harm reduction programs. Um, yeah, and I'll pass it to Commissioner Jacobs.
Hi, everyone. I'm Wendy Jacobs, Durham County Commissioner, and I'm in the elected official seat.
Karen, you're next on my screen.
Okay, hey everybody, I'm Karen Kelly. I'm in the business seat and I work with TROSA, who employs about 60 to 70 people in long-term recovery. Am I supposed to pass it? I'll pass it to Dr. Carter.
Hey, I'm Jamie Carter. I'm a primary care and addiction medicine doctor at Lincoln Community Health Center. And has Wendy gone yet? Okay, sorry. I'm not sure who else. How about Dawn Baxton?
Good afternoon. I'm Dawn Baxton, and I am the Chief Public Defender for Durham County. I will pass it to Kristen.
Sorry, I'm trying to turn on my video. Hey guys, I'm Christy Malott. I'm a senior assistant county attorney in the county attorney's office and here to assist as needed. And I'm not sure who else is, I'm not sure that I can see everyone on the screen who's on the committee versus Durham County staff. So maybe Brittany, you could call the next name.
Yeah, next on my screen is Alonsa.
I think it's her note taker. I don't know. Is she there?
Oh, yeah, Alonsa, are you here? Maybe not. Let's go to Paul.
Hi, sorry to be late. I was on the YouTube and that didn't seem to be the good idea. So anyway, I got a little confused with the links. I apologize. Paul Nagy, OSAC board member, licensed clinical mental health counselor, licensed clinical addiction specialist, and on the clinical faculty at Duke in the Department of Psychiatry.
Thanks, Paul. I believe that's all the members currently present, right, Shalisa and Jason? I'm just gonna count 1, 2, 3, 4, 5, 6, possibly 7. Okay, so we do have a quorum. Shalisa, did you call the meeting to order? Is that
Yeah, I just started it
okay?
before you jumped
Fantastic.
on.
Cool. Thank you.
Got it.
All right, great. Thanks, y'all. Thanks for being here today. I have a couple announcements before I kick it over to Jace. Oh, well, I guess before we vote on this new agenda, the amended agenda from last meeting. First, do we need to vote on the amended agenda? Sorry, before I make any announcements. Yes. Okay, thank you. Okay, so I will move to accept this amended agenda so that we can continue this.
Can I ask for a point of clarification, Brittany?
Oh, yes.
So just to, I noticed that the last two items were removed, I think, and then the minutes. So is that just clarifying what is not going to happen today? And can I also request that we do end the meeting at 6:30? And also, maybe you can talk a little bit about kind of next, like a timeline for future meetings, since I don't think it's gonna be difficult to get through everything in an hour and a half. So I just want to stop there, and also future meetings, if we can have the times allotted for each item, will help us stay, I think, really focused on getting things done. So did anyone make a motion yet? I forget. Because I'll be happy to make a motion to approve the agenda.
I see Dawn put this up there that she doesn't have a copy. Could we show it up on the screen?
Right. And when did this new agenda go out? Because I got tons of emails for everything else, but I didn't get one regarding the new agenda.
That, I believe Jason sent that out with a reminder at around 4 o'clock. And then I'll share my screen with the agenda. Once it loads, sorry, y'all. Okay. Okay, so this is our amended agenda, our continuation of our regular session from last week. We won't be reviewing and approving any minutes because we did that last time. We will not be going through recommended strategies and applicants, and instead we will determine our new process for evaluating applications. And sorry, I'm going in reverse order. First, we'll have a staff update in response to questions that we previously submitted. Then we'll determine like our new method for evaluating applications, and that will include a timeline. I have in my personal notes to allot about 45 minutes for conversation around answering questions, 30 minutes to agree on a new process and timeline, and then the remainder of our time to just like knock out any next steps or planning we need to do for our immediate next meeting. So we have a motion. Oh, sorry, go ahead, Commissioner.
Yeah, I wanted to make a motion to approve the agenda.
Okay. Great.
I second it.
Great. So we'll need to do a roll call vote. Okay, so do I do the roll? I'm so sorry, y'all, because this is the first roll call
Yes.
we've had.
Yes.
So I call on folks. Okay. So Shalisa.
Yes.
Okay. Dr. Carter.
Yes.
Paul.
Yes.
Dawn.
No.
Okay. Alonza, if you're here, might just be your note taker. And then I vote yes. So the motion passes.
I didn't vote.
Oh, I'm so sorry, Commissioner Jacobs. I skipped you in my line. Commissioner Jacobs.
I vote yes.
Okay.
I also didn't vote, Brittany.
I'm
and I
so
vote-
sorry, you guys. I'm so sorry. I think I was going down my windows are like not pinned, so everybody keeps bouncing around. I'm so sorry, y'all. Okay. I will do better. Karen, what is your vote?
Yes.
Okay, great. So the motion passes. And I just have a couple of announcements. I want to let y'all know that my understanding from Commissioner Jacobs is that we have until mid-May to make these recommendations without disrupting funding, and that we'll again go over our questions with Jason and other county staff, decide on a review process, set a new timeline, and again, we will be ending promptly at 6:30. So if we need to cut a conversation short, we will table what we can for future discussion. And I hand it over to Jason.
All right. Hey, thank you, Brittany, so much. I think next on the agenda, we just have the staff update, which will consist of three things. Just a reminder of statutory obligations, revised bylaws to be discussed and approved, and then the upcoming timeline. And so I'll just kind of just go down there. So just A for reminder of statutory obligations as well. First off, thank you guys so much for all of your engaged questions that you guys were able to send. I just want to send a quick reminder that through email, just ensure that we are not hitting reply all to any emails, and that these emails are also subject to disclosure under public records requests. Those are emails as well that I may be omitted to as well. They are also subject to public requests as well. Number two, conflicts of interest as well. I know this has come up before, I think through emails, but because the committee is able to make recommendations regarding the entire amount of money available, rather than only half of it going to the community, each person in this committee with a conflict of interest regarding community programs or county programs need to announce any conflict at the beginning of the meeting, and also to recuse themselves from participating in relevant discussions. Okay, everyone should be able to assess conflicts for themselves. All right. And number three, it's just a reminder just around public records as well. Again, it's just that documents created related to this work on this committee is also subject to disclosure under public records requests. The other quick question, Paul?
Yeah, thank you, Jason. The conflict question, I'm just kind of wondering how to discern that. For example, if there's a conflict related to one of the applicants, but no one else, does that mean you recuse yourself from the entire conversation, or just a conversation related to that applicant?
I'll
Yeah.
jump in and answer if that's
Thank you.
helpful.
Thank you, Christy.
Okay. This is Christy Malat from the County Attorney's Office. So part of the answer to that depends on how this committee decides to discuss and evaluate how you're going to allocate the money. So it's hard to give a very clear answer, but I would say if someone believes that they might possibly have a conflict and they want to talk about that specific situation, I'm happy to talk about it with them. I will say that I asked Jason to emphasize the fact that now my understanding is in the past we discussed the possibility, or I heard the committee discuss 50% going to the community, 50% going to the county. It's clear now that all of the money will be, and organizations considered in the discussion. And I think that's just important for everyone to know when making your own assessment. The county has a policy that addresses conflict of interest. And let me see if I can put that on the screen if that's helpful. And there are also statutes that are related to it. One in particular is 14-234. And so that's one of the things that should be considered. But if you give me just a second, I'll try to share the county policy too. And I hope by now everyone has attended the mandatory training that our office does related to serving on boards and commissions and committees, not boards, commissions and committees and task force for the county. If not, then please get with us so that we can be sure that you do have that. Let me see if I can share, sorry. Okay. Okay, hold on. There it is. Share, here we go. Okay, is that showing? No? Yes. Okay,
Yeah.
great. Well, this exists. And if you need a copy of it, Jason can certainly send it out. It's a pretty substantial document. It's the county's policy related to ethical requirements. And I don't know, Jason, I don't know if you want to send it now in case anyone doesn't have a copy of it or needs it. If you want me to send it to you, I'm happy to do that. But this is what the document is. So I would say if anyone has an individual question about it, you're welcome to ask me. I think the answer to whether someone should participate in the meeting as a whole, but just recuse themselves from one particular discussion depends on what the discussion is about. So if the discussion is about how we should rate. Well, let me think. Okay, and let me say, this is part of why it's an ethical obligation for each individual to assess some of these things. I do think you could participate in the meeting and still declare conflict of interest as it relates to a particular portion of the meeting and not necessarily the entire meeting. But it's also possible if the entire meeting is devoted to discussing something that a person has a conflict with, that they may not be able to participate in all of it. Commissioner Jacobs, I see you have a hand raised.
Yeah, I mean, I know this is a very complicated issue, especially I'm thinking about like with county commissioners, like we have an obligation to vote, in other words. So
Right.
it's really interesting because, and I'm thinking about this committee because everyone is serving to represent a certain population. And so I think there's also, I think this is going to be a big conversation.
Right.
Because if we lose that person's participation, then the question to me is then, well, then how does that affect the process? Because that, each person is representing a certain group of people or a certain stakeholder. And so we don't want to also lose that person's input because everyone has a very valuable, experience, perspective, expertise. So, you know, this is going to be a topic, I think, for a whole other meeting when we get through some of this stuff, because maybe we can also, as a group, kind of delve into this. Whereas, like, if it's like their application, or they're related to a board member or something like that, or they're going to have personal gain, but otherwise they should participate. You know what I mean? Because again, I don't want to lose the valued perspective of the membership of this committee. I would just say that. So anyway, and I know I just think of that because like there's very few conditions where like you have an obligation to participate in things as a county commissioner. I'm just kind of thinking about that in terms of this group, if that makes any sense.
I agree. I would just say if anyone has, and let me see if I can paste this here. Okay, hopefully I've just pasted the document in the chat. If anyone has a specific concern about their own potential conflict of interest, I would say probably better to identify it and we can discuss. Otherwise, we can discuss outside of the meeting.
Great. Paul, do you feel that your question is answered? Does that provide guidance for you?
Well, yes and no. I mean, I think yes. I mean, I think what Wendy said certainly resonated with me, and it's consistent with for those of us who reviewed applications, consistent, I think, of how we operated in that process. And so I would just basically generalize that to this process, would be how I see it.
Great, thank you. Jason, did you want to continue?
Yeah, thank you, Brittany. All right, so I think that kind of, hopefully, I guess it somewhat finish up the staff update. Once again, we got the reminder of the statutory obligations. Okay, second thing too as well is that we're going to have to revise the bylaws as well. That would have to be discussed and also approved. So there are some updates there, and the reason why that is because there were two lines at the very bottom of there, which pretty much required for any amendments that would occur with the bylaws would have to go to the Board of County Commissioners for every single amendment, every change. And we wanted to update that to say, so those changes will reflect within the committee only. And so obviously, once those are changed, it would still have to go to the county commissioners to get approved. But at least you can internally make these changes to the bylaws if needed by the majority through the committee. But this would be up for your review as well. And yeah, that'll be circulating. That'll go to the chairs, and then the chairs can review it and send it out to the committee. And if you guys propose any changes, feel free. It'll be yours to review and make that decision. All right. So that's that. And the upcoming timeline as well. I did hear mid-May. That's actually gonna be a super hard deadline. We're actually going to push that to May 1st. So Friday, May 1st. So if this committee would like their recommendations to go to the board, it would have to be by May the 1st. We typically get these type of recommendations around February, March. That was kind of something that we previously stated throughout December, January, throughout the earlier months. So we are vastly behind on things, and um, it does impend on so many different delays. And so when it comes to our processes, so yes, Commissioner Jacobs, yes, you're muted.
Sorry. Could you
yes,
just clarify, because I had previously heard with you and Kristen and Joanne
Yep.
the other day that that the middle of May was kind of like the ultimate deadline in order to kind of keep things moving. So I just wanted to get clarification on that.
Yeah, absolutely. If I received anything in mid-May, which is probably going to be that second week in May. That would push it to the very end. And obviously, there are some internal deadlines that I have to actually get it to pass through. Many teams are going to take almost 3 to 4 weeks from it leaves my hands till it gets to the county commissioners for approval as well. Please also be mindful that once the Board of County Commissioners do approve and sign off, if that is their will, that this also has to get signed off by OSAC with currency as well, which is another process. And if there's any issues that goes with currency, like it has for me in the past, it has been returned back, and I would have to make the edit, and then goes through there, and nothing can start until that last final approval is met. So we're trying to avoid, any severe late start due to that. So this is why I'm highly recommending May 1st as a hard stop. If you would like your recommendations to really go forward without there being any significant delays. I hope that's clear. Is that clear? Seems like I got some head nods. Seems like people are clear. If it's not clear, let me know so I can slow down and say it again. All right, we're all set. All right. Hopefully, I won't take up too much of your time, but you guys did send me 37 questions, and I'm not exaggerating with that. So I got about 37 questions. So I would try to compile them. I did receive some questions here in the last couple hours. So I'm going to take a few minutes to state the questions and then state a response back to it. Feel free to let me know if you guys have any other additional questions outside of this. And obviously, after this segment, I'll pass it over to Brittany, and you guys can further out the discussion. Any questions before I start? All right.
Jason, I just have one suggestion for Brittany and Shalisa, that maybe we hold our follow-up questions till you finish, so that everyone take down notes if you have follow-up questions to what Jason says. I'm just looking at the clock and it's 5:24 already.
No.
So that's my suggestion, is that we hold our follow-ups.
It's a great suggestion. Does anyone, yeah, that would also be my preference. Sound good? Great.
All right. I'm going to try to do this in a very time efficient way. Once again, there are about 35 questions, but I did clump them up to where I feel like they were compiled. I will actually state every question that was received, and then kind of give an answer that will hopefully hit on each one of those parts of those questions. That way it doesn't take entirely too long. I anticipate maybe 15 minutes at most, maybe less, if I can run through it. So, all right. So the first questions, or these group of questions, it dealt with the lack of transparency in funding allocations. We had about 4 specific questions. These were: why are funding allocations not aligned with proposal scoring? How were specific dollar amounts decided? What is the rationale behind the proposed allocations overall? And then why are lower scoring proposals receiving more funding than higher scoring ones? All right, so those were 4 questions that we received around the lack of transparency in funding allocations. And my response to that is the funding allocations were aligned with the proposal scoring from the working group. So the specific dollar amounts, where they come from, They came directly from each applicant's requested amount. There were no instances where lower scoring proposals were proposed to receive more funding than the higher scoring ones. However, it may appear that way just due to some differences in the requested amounts, and that's a key word, the requested amounts. So, like for example, if there was a higher ranking applicant that requested, and there were some, you can when you look at the application for like $90,000 or something like that. I'm just gonna give it a hypothetical. Like let's say requested $90,000, and their activities were fully eligible. Eligible by what? By the NCMOA. Then they would be recommended potentially for the full $90,000. If there was a second highest applicant within that strategy that requested, let's say 250,000 or 300,000, and let's just say that they also were fully eligible, or maybe they weren't fully eligible for that. So then that request would not, I'm sorry, then that request would then adjust based off their eligibility, and then that would affect the requested amount, not their ranking. It is based off of their requested amount. So that answers that group of 4 questions there. The second group of them, there's three questions around the opposition to the 50-50 funding split. We have shared this in the email quite a few times as well. Where did the 50-50 split recommendation come from was a question. What evidence supports this framework was a question. And why use a fixed split instead of needs-based or performance-based allocation? That was another question as well. Once again, these deal with the opposition to the 50-50 split. Once again, as previously mentioned, through via emails, as previously discussed, and also during last week's call as well, that the 50-50 split was actually a recommendation that emerged from the previous one of our previous opioid community annual community meetings. And it was during that meeting where community members thoroughly expressed a desire for funds to be contributed more directly into the community whenever we were able to open up an RP process. So keeping that in mind, we wanted to that recommendation, it was not a directive, and that email was underlined that it's not a directive, it was a recommendation. It was intended to reflect and also honor community input, community voice, and also promote equitable distribution of funds. I'll go to the next group of questions. This is the inability to make informed decisions. We have 3 questions here. What is the big picture of the funding landscape? How do county managed funds interact with OSAC recommendations? And how can we evaluate priorities without system-wide impacts? All right, those are the 3 questions that I received around that one. OSAC is really in the early stages of developing. This is my response. OSAC is in the early stages, phases of developing a more broader understanding of the full funding landscape. I think that's been a part of our conversations, especially as we've been putting our stuff around these learning communities. It's also important to note that the opioid settlement revenue also declines each year. That's something that we do know about more the big picture funding landscape to that question. That's also established on the payment schedule that can also be found with NCMOA. To also continue answering these questions, the county's intent is also to sustain existing programs. This has been a continuous message that's been spoken out. While OSAC does provide recommendations on potential expansions or changes to better serve the community. So that answers the question around how do they interact. So a more comprehensive evaluation of priorities will require continued engagement in that strategic planning process that we are kind of like, or that you guys are kind of already in the early phases of that learning priorities. So hopefully that answers, that's around the inability to make informed decisions. The next set of questions that you have are concerns about the voting process. The question that I received was, why are we voting before deliberation? Why doesn't the form allow do not recommend? And the other question was, how can rankings be ethical without full information? Excellent questions. The committee, here's my response to that. The committee is not voting before deliberation. Because OSAC was unable to move forward with the subcommittee or the working group recommendations last week. It was offered to this group a structured approach that was introduced. Is similar to the process that we use for the community health assessment. That is the same methodology and the same epidemiologists that we work in public health that actually creates this. This approach actually here actually allows for an unbiased, independent preliminary, keyword preliminary assessment. say the word one more time, preliminary assessment of rankings and also applicants. And as communicated from the emails as well, results from that forum will be reviewed keywords during the meeting, followed by full deliberation, after which members will have the opportunity to then cast their voice votes. Okay. The form does include options that would have to be updated, but the form does have options to recommend or to not recommend an applicant. It's also important to acknowledge that there are some information gaps that do exist, as the committee has only been established, I think, for approximately 6 months and has not yet completed or relatively even started the strategic plan process. So voting has to be done, just as another side note, voting will have to be done in public. And if we also use any tools like jot forms, you would have to put your name, it must be on it, and it also will be subject to public records. Okay, those are the set of questions and my response in regards to the concerns about the voting process / jot form. The next set of questions here is impact of proposed funding cuts on existing programs. Received 4 questions here. What services will be cut due to reduced funding? Will staffing positions be eliminated? Are there alternative funding sources to offset cuts? And what are the real world impacts on harm reduction efforts? I'll state this here, kind of similar to my last response here, but no core services were proposed to be reduced. No staffing positions were planned for elimination. Regarding alternative funding sources, one that we know pretty well is the City of Durham also receives opioid settlement funds. Additionally, the naloxone distribution efforts within public health have also been highly effective as well. We're also looking into other sources from other partners, such as EMS, who also, you guys are very familiar with their work, but we're also looking into many other sources there. We also, as you guys know, getting the naloxone from the state as well, not as much as probably that we'd like to, but that is also another a place of a source there as well. But in terms of overall funding, that is something that we're still obviously looking towards. I think that also came up in the learning list of people that we want to learn from according to Alliance. I've also had, obviously, I'm having talking to Carl like everyone else is talking to Carl out in Alliance as well, just around these things. All right, feedback from the working group, and, including from one of the OSAC members there. They highlighted around the safe syringe program as an appropriate setting for North Carolina harm reduction. And it was really based on this, a small portion. So in terms of the cuts, what happened, based on this, there was a small portion of that naloxone contractual budget, and that contractual budget only was actually reallocated to support that recommendation. That was just a recommendation. All right, next one I have misalignment between scoring and recommendation. Some of these questions I received, they kind of overlap with previous ones. So if it seems slightly redundant, I'm just kind of answering the question as they came in. There were 2 questions which kind of are redundant, but is why are high scoring proposals underfunded, and then why are low scoring proposals prioritized? I did have that response to question 1, but funding recommendations are aligned with scoring. We can go back. You guys have the copies of that of the scoring there. You can see who was recommended based off of those that had the highest scores. And so there are variations that were driven by requested amounts. And also allowability as well, which is another keyword to write down when it comes to understanding how the funding would work. The next one, role of and scope of OSAC versus county decision making. Once again, very similar question that you kind of already asked before, but here are 2 specific different questions here. And this is if OSAC doesn't set allocations, how can we separate strategy from funding? Why are we told not to consider county funding when it affects outcomes? So the response to that is OSAC's role is to participate in the development of a strategic plan. This falls under the collaborative strategic planning strategy, and also provide recommendations that inform how the county allocates funding to evidence-based programs, which is essentially our 11/12 evidence-based strategies that we have with the NCMOA. Concerns about the process design and fairness. Okay, we have 3 questions that came around with that. Is the recusal process being applied consistently? Why were all members not involved in full proposal review? Why is the application quality inconsistent? So 3 questions in regard to that, concerns about process design and also fairness. My response to that was committee members should disclose, as we mentioned earlier in this meeting, should disclose any conflict of interest and recuse themselves from relevant discussions as appropriate. I also would like to bring to your attention an email was sent out to the full committee on Friday, January the 23rd at 12:09 to be exact, requesting expressions of interest in serving in this very capacity that you asked about. We received 4 responses. That was Jamie, Dawn, Paul, and Brittany. No one else responded back to considerations around this process and to participate in the evaluations. The next set of questions, we're getting close to the end, and there was just one, and that is this was about total available funding clarification, and the question was, is the total funding amount 2.2 confirmed? And the response to that is the total funding amount of $2.2 million is not yet confirmed. It is not confirmed. It was actually something that we proposed to the county management and budget team to help address the significant volume of community funding requests from the RFP. Last set of questions here. What happens if, and this is like more, I guess, like program specific impact questions, I guess. Says, what happens if NC HRC funding gets reduced? That was a question. What happens to naloxone distribution with cuts? Kind of already spoke to that. Will EMS peer support expansion be affected? All applicant funding levels are subject to reduction due to the overall budget capacity. I'll say that again. All applicant funding levels are subject to reduction due to the overall budget capacity. And also, this is another key point, the North Carolina MOA allowability requirements. That also affects the reduction of numbers as well. When you look at the budgets, when you look at the applications, you look at the activity line, there's a budget number that's attached to that. So whenever there's someone that's not allowable, then that whatever that number is, it automatically goes out. We cannot pay for that. All right. If we pay for something that's not allowable, then we are subject to pay that money back. Okay. So I hope that's pretty clear. All right. Trying to think if there's any other questions here. There's a few more. Let me see. Sorry. All right, let's ask you, I think I have some more questions here. It says, which line items, line item question, from the previously funded programs, FY 26-27 budgets are not allowable for the opioid settlement funds? And I'm going to say this word here. So under the NCMOA and the national settlement terms, funds can also be used for opioid remediation purposes only. I think you guys all know that. But generally, here are some not allowables. General government expenses, so any admin expenses which you will see on these proposals, and that are not tied to the program or not. No indirect expenses are allowable. Okay. Law enforcement activities unrelated to opioid remediation. Capital projects not tied to treatment, prevention, or recovery. If you look at the Exhibit C, which is I believe I sent that to you all in the last email. If you look at there, you'll see that one of the strategies actually does allow capital projects in proportion to into their application, but that's only for that one specific strategy. Okay, so this is generally not allowable. Number 4, supplanting existing funding is not allowable. So that's replacing what the county funds. Okay, so that's any existing funding with settlement dollars instead of adding new or expanded services. So basically, you cannot use opioid settlement funds to pay for something that the county or another funder is already paying for. Okay, so that's clear. All right. Anything that's broad public health activities that are not opioid specific, we cannot pay for that. That was a shocker for me. I could not go to certain public health events. I'm in public health, and I could not go to it because it has to be opioid specific. Okay. And then the last one, I kind of mentioned Jarrell, but indirect costs that are excessive or not program justified as well are not generally allowable. Okay. And I'll also say that anything that's not probably in direct services, anything and all things that are in option A, which is what we are under, are what makes it allowable. Anything that's not in direct services is always going to be questionable to whether it's allowable unless you can tie it to it. Okay. All right. So let me ask another question here, and I think it's like the last 2-3 questions, and I can pass this on. What was the revised or negotiated amounts The amounts presented in the previous spreadsheets for the CBO proposals cover. What would they revise funding amounts go towards? That was a very, very heavy lift there. But once again, that actually goes back to, well, first off, there was the initial funding amount, which I just had mentioned earlier to you all. And then there's the reduction amount that's due to what? It's due to it not being allowable via the NCMOA. Okay. And then you also have budget constraints as well. All right. And so everyone knew to scale down their budgets. They were not going to be able to get it. We had a $6.5 million request. Okay. And then obviously not everyone was going to get selected. All right. So everyone was scaled down on their budgets, and they all went towards essentially their core functions. Because once again, on the NCMOA, it has to be direct services. So anything that goes to their core functions is what we were looking to do to fund, or what they were willing to fund. Well, another question here that I received was more of a legal procedural question, and that was what sort of recusal process should we use? How to report conflicts, and what elements of discussion to recuse from? Once again, another excellent question. And so once again, this is something that the committee we would have to kind of develop and put out there. But I think that there is a recommended process, and we kind of already been doing that as well. And that's like disclosure, step one, disclosure, that everyone must, verbally disclose the conflict at the start of the agenda item, period. Any conflict should be documented in writing if possible. You can email me, Christy. She also mentioned that as well. You can do that. So step one, disclosure. Step two, enter into the record. Make sure that this disclosure is recorded into the meeting minutes, in which it will. Step three, full recusal from participation. So that committee member, it must step away from discussion, deliberation, and voting in that particular. I think Christy did a good job of trying to explain a very complicated matter. And then since we are in a virtual setting here, and I don't know what that looks like, and maybe Christy could give more information, but maybe that's like muting cameras, maybe it's like leaving to a breakout room. We'd have to figure that out and lay that out for that process for recusal. But I will leave that up for you guys to discuss and make that decision on. So once again, what requires recusal, I think you guys know that. You guys mentioned as well, financial interest, leadership or board role or anything like that, or any close personal or professional relationship that could cause biased judgments. You guys already took the ethics training, so you guys are well aware of that. So essentially, if you have a conflict, you must disclose it, that this is what it is, and then fully step out of the discussion and voting on that item. I feel like I'm almost done, and I keep going. I feel like I have 5 more questions. All right, so for recording independent recommendations from us, I think the question is from between tonight and eventual vote, do we attach the completed documents to the agenda, read it aloud into the record, particularly with respect to open meetings law? So for recording independent recommendation between now and the final vote, members should not submit or share individual rankings outside of the formal meeting process. That's very important. So really to remain consistent with the open meetings law, to remain consistent with the open meetings requirements, all deliberations, that's all, email, anything, all deliberations and decision making should occur during a properly noticed public meeting as such. Any materials intended to inform the committee's discussion should be shared with staff for inclusion in the official meeting records, and also distributed in accordance with the public access requirements as well. Independent inputs collected through the structured form will be compiled and presented during the meetings per the email that was sent out as well to also support discussion. The committee will then deliberate in open session, and then any final recommendation will be made and also recorded as part of the official meeting record. And if there are any specific procedural questions related to compliance, there's Christy Malott. She's on the line to help out and assist with that as well if needed. What is our process for sharing out email communications such as sent as public comments? In a previous meeting here, this actually came up about public comment, about whether we should have it in or out. But once again, that decision will be with you guys as well. But essentially, all public comments will be what I did here recently, just so we can start receiving some public comments. They have been coming; they just been coming to my emails, but all public comments should be submitted via email and should be provided to staff and included as part of official record. These communications can be distributed to committee members in advance. Essentially, what I did was I put like a little link in our last in the last newsletter. People to click on the link there, and then they can put in there, so that way it can all get centralized to me, and then I can do whatever y'all want with that If y'all want it read throughout the meeting, if you guys want the chair, I mean, whatever it is, I'll deliver it to the chairs, and you guys can figure out how you guys want to handle public comments. So it could be during the meetings. Public comments you could be acknowledged, or it could be summarized, because sometimes they can be super duper long. And so you can be summarized for the record, but the full deliberation and consideration of those comments should take place in an open session as well. So if there are any specific questions about those, like I said, Christy can hand off for that one. And I think there was a couple more questions, kind of redundant, but this is just confirming some things that you guys have questioned about before. And that was once again about the 50-50 split between county-based orgs and county programs came from the county. Yeah. So was it not a directive? You guys want a confirmation around that? Yes, it was a recommendation. If you go back to the email underline, it is actually not a directive. It was a recommendation based upon the previous response that I gave earlier. It was based off honoring the voices of the community that asked for more money to go out the door. So that's kind of answering that twice. The last one here is, I think I already answered that question as well. That's the revised one, I think. Okay, that was the revised and negotiated funding amount. So I think that's essentially all the questions that I asked. And I think one more, sorry, it's my last one, I promise. There's currently $1.5 million of opioid settlement funds for the BOCC to allocate for FY27. This is what someone had mentioned, and I'm just confirming whether this is true or not. This number may change in the future, but as of April 16, 2026, $1.5 million is the amount secured for this allocation process. Yes, that is the case. We are annually, if you look at our payment schedule, that $21 million that we get over the years, if you just annualize it, do a quick division, you'll see about $1.3 million is what we have to spend across the county, community, whatever. And so that's why when we looking at all these things, obviously it's a small pot of money, but we are looking to hopefully get an increase. We're proposing an increased amount so we can answer or fill in some new requests. And I believe that is all of the questions. I think that's like 35 bundled in, and hopefully that helps to resolve some things. Hopefully you were able to take some notes if needed. But I will pass this back over to Shalisa and Brittany for any further questions or for you guys to further deliberate.
Thank you so much, Jason. I know that this was a lot, and I think I speak for all of us when we say we really appreciate this massive download. Thank you so much. Oh no, my computer's doing something crazy. Does anyone we have about 7 minutes before we should move on to our next item. So does anyone have any follow-up questions or related comments? Yes, Commissioner Jacobs.
Yeah, I think, this is more related to something that when we have our discussion, and thank you so much, Jason. I want to just, first of all, thank everyone for submitting questions, because everyone is very conscientious in this group and trying to do the right thing. And Jason, thank you for taking the time to respond to all of them. But just, I do think when we get into the discussion part, the issue about that no core services are being reduced, to dig into that, because for me, I still have questions on knowing what different departments requested related to previously approved positions, and supplies and things like that versus what is, what their actual requests for which versus what we got as a recommendation. Also, I think I'm still confused about, I know the working group, and thank you to all the members of the working group for all the incredible amount of work that you put into reviewing everything. But it wasn't clear to me that the working group actually ultimately came up with those recommendations that came to us. It seems like it was maybe just part of the working group, the staff part. So I just want to, again, I don't want to get into a back and forth, but I just think as we move forward on this. And then the other thing is, I think there is still confusion also, but we can remedy all of this as we move forward related to, the scoring versus how much funding was recommended. There does seem to be a disconnect. And so what I really appreciate what you raised, Jason, about us really getting into like what is eligible and what isn't eligible according to the state. And I hope that when in the next part of the discussion, we can talk about, I know we have a short amount of time, but coming up with some document that is going to help us, that we'll be able to document for us, okay, in that application, what isn't eligible, so that we can better understand where some of this is coming from. So I'll stop there. So it's not really a follow-up for Jason, but more like continuing questions I have that I hope we can address in like how we move forward.
Thank you, Commissioner Jacobs. Does anyone else have anything before we move toward proposing proposing like another evaluation recommendation process?
Yes,
Okay.
and again, I'm not sure we need to like answer this question right now, because it may be that we'll keep thinking about it. But I guess I do still feel confused about the difference between the funding amounts that were requested and the allotments or the proposed kind of allocations on the form. For instance, like an example would be the North Carolina Harm Reduction Coalition, who I think asked for about 288,000, and then 75,000 was on the form. And yeah, it sounds like maybe some of that reduction was related to things not being allowable, but I doubt that that's true for that entire amount of the reduction. And so just kind of it'd be helpful to clarify exactly kind of what is and isn't allowable. And then like probably it sounds like there was some of that was just a budget reduction related to the overall kind of large budget ask and just general reductions. I don't know that Jason needs to answer that right now necessarily about the specific program, but I just still kind of in general do have questions about that distinction, and wanting to make sure that we're fully funding as much as we possibly can programs that especially scored highly, like the North Carolina Harm Reduction Coalition.
Thank you, Dr. Carter. Does anyone else have anything in the next 2 minutes before we move? Yes, Karen.
Well, maybe I'm already moving into the next thing, but just based on what Dr. Carter said, it seems to me it would be helpful for me to see each application under the strategy, kind of like what we had, with the score, that applicant score, with their request, and then maybe a second column that what is their request once we take out what's not allowable, so that we know what the 100% ask is for that, 100% allowable ask is for that project. And then move forward into, cutting back. I don't want to cut everybody back so much that we end up not getting to do anything well. So those two numbers would be very helpful for me to have sort of in a spreadsheet.
Thanks, Karen. So that actually does segue into a spreadsheet draft that I created. This is like just a jumping off point. We do not have to, I'm not saying that we have to use this at all. It's just a thing to get us started, but let me show you what I have. If I can find, hold on 1 second, sorry. I had a lot of tabs. Okay. We are looking at that, I believe. Okay, everyone, can you see? I know I'm gonna need to zoom in on this, but can everyone see essentially the basics of this? Or see that this is a spreadsheet? All right, great. So what I was thinking about, I was trying to find a way to include this information, a lot of which we have asked for or kind of lives in disparate places right now. And this is just this is my proposal. I would propose that each of us fills out our own review sheet, not to the extent of our esteemed colleagues and county staff who did the giant review before. That's such a lift. I would recommend that we put the proposal name in this first column, the strategy that it's associated with, and then for our own, this is like part of there's a public health method called the Delphi method that uses this, and some other methods that also incorporate this, but rating like our own expertise in each strategy so that, like, for example, I do not have expertise in like peer support services. And so I can rate that application, but if y'all were to look at or I can say what I think about that application, but if y'all were to look at my scores, then like it might be good for y'all to know that like I have little or no experience and expertise in that area. And it would be good to be able to kind of like, as we are looking through each other's recommendations, being able to look and see, well, this person is an expert in recovery support or in like MOUD delivery. And so this is, good to know when I'm looking at their comments. I would recommend that we would put the initial score from the initial reviewers here, then the amount that they funded, that they requested, the allowable ask from that funding, as Karen mentioned, and if they were previously funded, the amount, the level at which they were previously funded. Then it would have a recommendation, so we could select, these would be drop downs. So you could select fully fund, partially fund, or do not fund for each application. And you could put your recommended funding amount here and any comments. And then down at the bottom of your own form, there would be a running calculation of your own funding recommendations so that you can keep in mind, like, one of the hardest things for me about allocations for funding is like weighing that like there are good applications and also there's a limited amount of funds, right? And so I think keeping that in mind coming into our conversation, like with that total, like kind of running in the back of our minds, could be very useful. The last thing I'll say before I ask y'all for thoughts and questions and suggestions about process is that I know that in several of the emails we received, there is like there is a sense among at least 5 of the members that or a preference to prioritize the county requests and the previously funded, particularly requests in our deliberations. So I would recommend that when we come to that time, we discuss those first, but this is like a collective process. So obviously that's just one person. Yeah, and that's all. Does anyone what do y'all think? Yeah, Dawn.
I think that we do not need to come up with a whole nother process. There was a group of us from this committee that work with in the small group, evaluated these applications based on our mission statement and the perimeters we were given to rate those applications. And we all came up with the scoring, and the highest ones were the ones that we recommended based on who we thought best fit the strategy. And now you're asking us to do that again, which gives the impression that you don't trust or respect the process that a portion of your committee has already gone through. And some of the things that you have on your sheet, we did that. And so now you're asking us to do it again. And then to have us talk about our level of expertise and all those things. Again, we were all chosen because of our expertise in different areas so that we could come together collectively and decide or recommend what was the best strategy or the best applicant under the strategy to the commissioners. And so your group members have done that on behalf of you. And it seems as though somehow there's been this desire to go off the rails and change which direction we were going. We got hung up on the last meeting about the 50-50 request. Well, we just heard that was from the community. And so we can't say that we're here for the community and then ignore what they are asking for and then come up with a different process to get to something that maybe is not what the community is asking for. Then we have this narrative of it's going to cut county programs. And I don't know where that came from because that was never anything mentioned by Dr. Jenkins. In fact, his exact words were, we realize that some of this has to go out to the community. We cannot be greedy. And we want that. And so I'm not understanding why we seem to be doing the same work twice to get a different result. I mean, there was an opportunity, like Jason pointed out, for whomever wanted to participate in the reviewing and scoring of these applications to do so. And then after the reviewing and scoring was done, Jason sent out the applications with the comments so you can see why the scoring, what it was, and why those were being recommended. So I don't see why we were being asked to do the process a different way twice because some don't like the outcome. I think it's disrespectful and not respectful of the time put in by your colleagues to review all those applications and score them before. And so I don't see the need of coming up with a totally different process of review.
Thank you, Dawn. Paul?
I actually I appreciate, Don, what you had to share as one of those participants. I guess I'm kind of just in terms of the private. I appreciate kind of what you're putting together, and I get it. And part of this is just my utter confusion about what kind of how do we even define the processes. I'm just trying to get clarity on the structure of this and from beginning, middle, and end. So let's talk about maybe beginning because I'm clearest about that, which was we had a work group, all the ways Dawn described the work group functioning. We had a work group basically take on the task of reviewing the, kind of the validity and the, and the capacity of those various applicants. But what we did not do is we didn't make any, I don't think we had any conversation about it. We didn't deliberate at all as to who should get what for what particular reason. I think my understanding was we were basically providing data for the next step, which was to consider our priorities and the big picture in terms of who's doing what, who needs to continue doing what, and are they kind of the best based on the scores, the best person to continue to do what, and then what do we have left and how do we allocate the remaining funds? And that just kind of seemed pretty logical to me. And I kind of thought that's where we're going. And since kind of, I don't really know where we are, to be honest with you. And this is part of what I think I'm confused about is are we making this more complicated than we have to, or can we just build on? I think this is what Dawn's saying, and I fully agree. Can we just build on what's already been done and use that as our base and then kind of define the next objective, which sounds like we need to provide a clear, considered recommendation to the county commissioners about what we believe is the best use of the funds. And in terms of, figuring out the allocation, that was the one thing on your grid. I appreciate what you did and put together and made a lot of sense to me in a lot of ways. But, then we all have to do math and figure out, okay, well, we gave this one 50,000. What do we have left to give somebody out? Then it gets a little weird to kind of, for me anyway, to think about how to do that. I think it's more a matter of, identifying again, kind of the strategy that needs to be addressed that and funded to whatever level is consistent with our prioritization of that need. And what maybe a percentage is better than an actual number. I don't know. Anyway, I don't want to go on and on, but I'm just trying to be less, and I appreciate your efforts to try to help us be less confused. But Dawn kind of triggered this for me, like, no, I think this is just making it a little bit more confusing to me anyway. Thank you.
Thank you, Paul. Commissioner Jacobs?
Yeah, I just have a clarifying question, Paul. I know you and Dawn and Jamie were the three reviewers who represented the advisor group. But were you involved in the information that ended up coming to us, which had actual, recommendations of which organizations to be funded and at what level?
No, and that's part of my confusion.
Okay, so
When I saw that
that's
document,
really helpful
I didn't
because
know
I
where
think
they,
that's
unless,
okay.
yeah, I
Thank
defer
you.
to Jamie and Dawn, but my
Okay,
recall is we didn't.
that's just what I want to know because that's why we're here where we are. Because that, everything was great up until the reviewing, but then the rest of it does not reflect the role of the task force. If you go back to the purpose of this task force, according to the state, is that it is supposed to be the body that makes the recommendation to the Board of County Commissioners. And I personally want the best recommendation possible to come from this committee. And okay, babe, you can clarify that in a minute, Jason. But I personally support what you're putting forward, Brittany, because it incorporates the work that came out of the committee in terms of the ranking and also then we also get the staff input, which is the staff that came up with the recommended amount. But it also includes all of the programs because the previous information didn't include everything. It only included the community-based organizations. So I think the reason, and I hear you, Dawn, and I hear your frustration, but I think that Brittany builds on, what's happened and expands it to actually, I think, address the concerns of the committee and will help us come to, I think, a much stronger recommendation that is going to be ultimately more helpful to the Board of County Commissioners, because that's what I think is most important here, is for this body to come forward with the best possible, based on all the information. And if we're only getting bits and pieces of things, then we're not able to make a good recommendation. So I want to thank you, Brittany. I think it does honor what's happened so far, and then it builds on it, addressing the concerns that different committee members have expressed.
Thank you, Commissioner Jacobs. Dr. Carter?
Yeah, I hear Dawn's frustration, and I think, my sense of being involved on the review committee was that we did the scoring, and then we kind of collectively looked at the scoring to sort of see if we tended to agree that the highest scoring, proposals in each strategy, do we generally agree on those? And I think that's kind of what we did as the review group, but we definitely weren't involved in any way, like has been said before, in sort of figuring out what the allocation would be. And I think, like, if we're being asked as a committee to think about that and to make a recommendation to the commissioners, then I don't think we've done any process for that in a formal way. And so I do think, yeah, and it's not clear to me exactly like what the commissioners are asking for in that regard from us, but it seems like they're at least asking for, yeah, do we generally agree with these allocations that are proposed or not? And I don't as they currently stand. And I mean, I think we, or I just have questions about them as they currently stand. And so, I mean, I think the next part of the process, I think, is looking at those allocations with kind of the priorities in mind and seeing what makes sense. And so I do think we still need that part of it. And whether that looks exactly like the spreadsheet that you've proposed, I think something like that would work for me. But yeah, I do think in general, we still as a group need to think about how does the scoring is one piece kind of which helped to identify the top scoring strategies in each group. How does that fit in with what we can fund, because I mean, I think we can't fund everything. And so, or the commissioners cannot fund everything. And so we have to, if we're being asked to make a recommendation, then we have to look at those priorities. And I don't think that we've done that.
Thank you, Dr. Carter. Anyone else? I will say, and this is like, obviously, this is not the last word. But I will say that I do want to thank you, Dawn and Paul and Dr. Carter, for all of your work in reviewing those applications. I know that it's a huge lift, and you evaluated on like so many different areas that like as a full committee we would not be able to evaluate on in a timely fashion. So I appreciate that a lot. And yeah, I definitely do not want to disregard all of the work you put in. I think it was foundational, and I think that the scores, for me at least, were and I think for many of our colleagues, were like really illuminating in terms of like, okay, like where are our colleagues who are expert, everyone here, like you said, Don, is an expert in something. And so what are our expert colleagues thinking? Yeah, I wanted to also address that, like, I do completely regard all of you as experts, and the rating of expertise was really just like that doesn't, that can go out the window. That was just like it's a common method in public health decision making, and it can help like evaluate your own knowledge and understand a little more about like your colleagues, like confidence and knowledge in a particular area. And my thought was not that it was like, how much of an expert are you on opioid settlement funds, or like more generally it would be like per strategy. Again, not necessary. I just want to clarify that like I absolutely regard each person here as an expert. Does anyone else have thoughts, comments, ideas about how to move forward? Just noticing that we have 18 minutes left together tonight. Yeah, Paul.
Oh, I just actually want to be maybe I'll transition this in a positive note, which is I think one of the things that was accomplished to the point about building on kind of where we are, however we choose to do it, I think we took away the burden of having to consider so many, because I think we were able to actually, with the scoring, be clearer and more focused on who really is around, who can best address the needs. I think really the question for us is what are those needs on balance with what's being provided and can be provided by others, and what's still left to be supported, and should we be committed to those things, and if so, to what degree? And I think just getting focused that way would be helpful. So I think we actually are in a pretty good place if we just build on that foundation. So and thank you for the support, that all your comments and the comments of others too, because yeah. And as a committee, I can also say, and I'm just one member, and Jamie and Don can speak to this too, but I also think we worked really well as a group, and how we did this, and we really did have pretty consistent consensus throughout. So we got something to work with, I think, is what I'm trying to say.
Thank you. Thank you so much. I think, yeah. So I'm seeing Commissioner Jacobs' comment that about if we can recommend a budget of 2.2 million and use that as the amount. I think that's on the table. Yes, Karen.
So I want to say, and I sent some personal emails or some emails to the reviewers, that I really appreciate the time and the depth of attention that the reviewers took on those. I'm very grateful that you all did that. And my plan, if we move forward with the spreadsheet or anything else, is to use your evaluations as that guidance. I think it seems to me that we've got more recommendations than money, and then we have the difficult task of figuring out of the programs that you all evaluated highly, how do we get that down to 1.5 million, or maybe crossing fingers 2.2 million? I would recommend that we actually make 2 recommendations. One recommendation if we only have 1.5, and then an additional another recommendation if it does get approved to be 2.2. So I'm not tied. I personally think in spreadsheets, Paul, I totally honor that not everybody is like a math nerd. So for me, it's a helpful tool because it's kind of how my brain works. But I'm not invested in any particular tool except just some way to get us from you all, the core group who did the evaluation, to move forward from that to 1.5 million, and the programs that we think will have the biggest impact on frankly saving people's lives. At least that's where I would prioritize, is those ones that address that most. So that's what I'll say.
Yes, Dr. Carter.
Just question. Are the commissioners looking for us to recommend a budget with specific funding allocations? Or are they looking for us to recommend like more of a narrative statement that these things are our top priorities? We think these things should be fully funded, and then pending availability, these would be low. I guess I just don't even know exactly like what the outcome of this that would be helpful to the commissioners, or what they're looking for from us is.
Yes, Kristen, and then I would ask Wendy also.
Oh, well, if you want Commissioner Jacobs to answer that question first, because I have another question.
Oh, okay, cool. Thank you.
Yeah, I think, Jamie, I think what would be most helpful is both. I mean, normally when we get recommendations from boards and commissions or from staff, it is, it is that specific. I mean, it is usually, we recommend that you prioritize funding this and for this amount, knowing you have this budget. I mean, we have many different, we have, for example, Durham Open Space and Trails Commission. We have a matching grants program. They evaluate the programs and they present a budget to us with what they recommend being funded. And so, yeah, I mean, that is, yeah, both would be. And I just want to do a time check, Brittany, and I don't know if you want to have us vote on the next, whether to use that proposed spreadsheet, or if anyone wants to add something to it or change it, but it's 6:18.
Thanks, Wendy. Kristen, I know you had a question.
Yeah. So Shalisa dropped a spreadsheet in the chat, and that spreadsheet actually has all of the strategies, all of the agencies that applied with the scoring that the committee, the smaller subcommittee, they scored the applications, along with the original amount that each agency requested. So, I don't know if you all want to use that, because the next column says OSAC recommended amount, how much you all will want to recommend whatever agency that you all want to fund. And if you did that, because that's what I'm hearing you all say, and I may be wrong, but that's just hearing the conversation. That's what you all want to be able to do, is align. You all want to make the funding recommendations. So, you could use this sheet if you wanted to, and I think it may, and you can put notes in there if you want to add notes. But then once you all make the recommendation, then we could go, Jason and I could go, or begin to add the allowable expenses. And if we take out what wasn't allowed, then we could put that revised amount there for you guys, if that's what you want, and then bring it back to the committee. Can you all open that form or?
Yeah, I can share my screen
Okay.
too.
And I'm just thinking maybe this is
Yeah.
what you all are saying, and this kind of makes it a little easier.
Yeah, so one option, yeah, would be to go through this together or individually and then come together based in like assign recommended amounts. And then as Kristen was saying, she and Jason can work on filling in the revised amount. So that is, oh, sorry. So that is, yeah, that's totally an option that could work, I think.
But you know what, Brittany, this doesn't show the previously funded amounts.
Mm-hmm.
I mean, just comparing it to your document, it doesn't show the previously funded amount. I think,
Okay.
yeah.
I could
I
add
mean,
in because it was only a few people that received funding.
okay, yeah, if we could add in, I'm just thinking about what's different, what's missing. So
Absolutely.
yeah,
Mhm.
previously funded would be helpful.
Mhm.
Perfect.
Yeah.
And then, awesome. Thank you.
And if you want, Brittany, we could make this like a shareable form, so we could go ahead and put that information in there, so you all will have it.
Awesome.
It also doesn't have the score.
The
Oh,
score
I don't,
is right.
oh, I see, the score is right included
Yes.
there. Okay,
yeah.
got it. Okay.
Awesome.
So that might be helpful.
For sure.
And the ones who don't have, like, has a zero, the committee saw that those were the agencies that were not in Durham,
Great.
that did not serve Durham. Yeah.
Yeah. I also have one clarification. I think that the recovery support services, I think it's important for the committee to understand that that used to be RI's program, used to be the county's community linkages to care program. So it's not a new program. They took over the public health community linkages to care. It makes it look like that's a new program, but it's not.
Okay. That is good to note. Great.
Yeah.
Awesome. Thank you. Karen, did you have, and Shalisa?
Yeah, I just wondering for, I guess, Kristen and or Jason, have you already gone through the budgets to know what the allowable amounts are, or is that additional work, or have you already done that?
Yes, so Jason has followed up with OSAC with every budget,
Oh,
see what was allowable and what wasn't.
Yeah.
So we didn't do it, but OSAC did.
Yeah. So they typically do that. We tend to, so what we're trying to get everyone to do is not, we're focused a lot on that. And I think we want to get what's actually, what do you guys want to do? Because a lot of it is nuance and it's like a line by line. It takes a large amount of time to go through that. And so I think that because if we had to just, the last 2 years that I've been in this role, it's the same thing. And they're like, that is not reliable. I'm like, okay, I got to go back and fix that as well. So if you guys give me what you want first, and then I can go back if I need to get some nuances or if I'm questionable, like I usually can figure it out myself. And then I'm like, this is questionable, this is maybe questionable. Take it to OSTAT, let them run it and let them do that. But if we wait for that, we'll never get this out the door because it's very, very timely. And it's actually per strategy, sometimes what's allowable as per mentioned. So if you guys would
Sure. I was just wondering if you guys had already done. I wasn't clear from what Kristen said, if that had
yeah,
already been done or if
it's
that
it's
needed to be done.
it has been done. I mean, to some extent, if I look at it, I mean, I've been doing this for a little bit, so like I can for most part take out, but it doesn't really help me because that's based off of the subcommittee, but that doesn't reflect you all collectively. So that's what we're trying to get you guys to get to the point where you guys can collectively come up to what you want, and then say, hey, Jason, this is what we want. Does this align? And I can say, got it. We'll check and see if it aligns. Does that make sense? Is that clear or no?
Um, Sure.
Okay. Actually, I mean,
I mean,
Karen,
I was
hey,
just, I
Karen.
was just asking,
Hey,
I was just asking because Kristen, I just didn't want to ask Kristen. She was saying that you guys already maybe had that number, and so I was just trying to figure out if it
No,
was
we
just
were
But that number was based off the subcommittee.
right.
It's not based off of everybody here.
No.
That's kind of the
got.
point. That's the point.
Oh,
Like it's
okay.
based off the subcommittee, and the whole committee might have a difference of opinion
Right.
around a lot of things. So before we do that last leg of delineations, let's get the entire say so on this, and then finish out with that. That's always my last step. Is going through a step.
Okay. Got it. Thank you.
Yes, ma'am.
And then Shalisa.
So I just make a motion. I want to make a motion to propose that we use the spreadsheet along with the amendments or the changes or the additions, I should say, that Brittany's made at the column asking for the previous amounts for the programs that have been previously funded.
Do we have a second?
I'll second that.
Okay, I'm gonna look at a list of everyone here so that I am not
I,
missing a
I,
person.
I have a clarifying question because
Oh,
I'm
yes.
still, I'm a little, I don't want to lose, I think, some of the information that you had incorporated in your proposed spreadsheet, Brittany. Are there any other things that you think we would lose by going with the second one? You know, because I just want to make sure this is important that we get it right this time. And so I just wanted to hear from you. Is there anything else? Because I think there was also whatever. There was also another data point, which was the recommendation that did come out originally. Is that something we want to look at or not? Or are we just going to scrap that? I mean, that did come out of at least the staff. Or do we want to just, and then also the part that you said about your own expertise and then will there still be room for people to write comments explaining why they voted a certain way? And there will there still be the recommend, partially recommend, do not recommend? I guess I'm kind of, I'm just a little bit concerned about, I can't really evaluate. I'd like to look at both things at the same time. So since you know what you proposed, I just want to hear from you on this.
So the only difference would be the self-rated expertise. There is a column for allowable ask. It sounds like some folks, I personally feel that it would be useful to know what's allowable, but I also understand that that's like a huge lift. And then I imagine we could add a column that's like, do we recommend fully fund or partially funding? And then for sure, a comment for or a column for comments. That's what I heard Kristen mention, and I think we would want that. Does that answer your question?
Well, then also do not recommend, right?
Oh, yes. And then do not
Yeah.
recommend would need to be an option.
Right.
So I think we
Yeah.
would, yeah.
Okay.
So
All
fund,
right.
partially fund, do not fund.
Okay. And then the other thing, I guess, hearing from staff about whether we could assume 2.2 versus 1.1 for what we could recommend as the amount.
So we want to know if we can use the 2.2 as a recommended amount. And that would go to, I guess, Kristen and Jason. And we have 1 minute left.
All right, I'll take 10 seconds. I would say shoot for the stars. I think we fought for that number, so I would say go for it.
Thank you. And then Paul.
Yeah, I was just going to say I seconded it because I actually heard to your point, Wendy, that's actually what Shalisa was proposing is to merge these two. Maybe that's how I understood it anyway. Is that right, Shalisa? Okay.
Yes.
All right. So we have the motion, we have the second, and now we will vote. Oh, Karen would like to know if we can rank so that there's like a 1.5 number, like a highest priority and a like for 1.5 and then a 2.2. I think that's easy to add to a column. That's like first priority, second priority, maybe. Great. So please say your vote when I call your name. Karen,
Yes.
Paul,
Yes.
Dawn, Dawn,
I'll abstain.
okay. Dr. Carter,
Yes.
okay. Shalisa,
Yes.
Commissioner Jacobs,
Yes.
okay. I vote yes. Has everyone, have I missed? Who have I missed? All right. So it sounds like the motion passes. So it sounds like next steps are to send out the amended worksheet, spreadsheet. Kristen, do you feel good about doing that? Would you like me to? I think I kind of made notes in my copy if that's easier for you, whatever's easiest.
That's fine. Jason and we could send it out.
Great, thank you so
And I
much.
think it would be best if we send it to you and Shalisa, just to make sure
Okay.
that what's on there is what you all want, and then we can
Cool.
send.
That sounds great. Thank you.
Mhm.
And then we do need to do, we need to figure out a date and time for our next meeting because we have a May 1st deadline.
And also a deadline for everyone to complete the form.
Yes, thank you.
Yeah.
So let's see, let's pick our next meeting and then move back from there, maybe about the deadline for everyone to complete. Does this time next week work for folks? So it would be 5 p.m. Thursday. No, not working. How about 5 p.m. on Wednesday?
Oh, actually, I for myself, I thought you were talking about Wednesday, not Thursday. So it's Thursday. You're talking.
Okay.
Yeah,
Yes.
I could do it Thursday.
Okay. And
I
then,
think the Durham joins together.
oh, yes,
Overall meeting is on Thursday next week.
you're right. Let's look at Monday at 5 p.m. That's pretty soon, though. I don't know if we'll have enough time.
I've got a 4 o'clock doctor's appointment, so I'll get on as soon as I can, but I may be late.
Okay. All right. And then, so we would be asking for everyone to complete this spreadsheet by, do we want it done multiple days before we filled it out? We've each had a chance to fill it out, or do we want it to be, or rather, do we want to have multiple days to review each other's recommendations? Do we want to have? My suggestion would be like Sunday at 5 p.m. if we're going to meet Monday at 5 to at least give
So
folks.
we would be getting this tomorrow and would have to work on it over the weekend, I guess.
Mhm.
Yeah.
So maybe we go Tuesday. We meet it on Tuesday, and because that would also give time for the responses to be compiled.
Mhm.
Because I think our next step is the voting part. So I'm also wondering if Wednesday at 5 would work for folks.
Wednesday at 5 is better for me than Tuesday at 5, but I can
Okay.
I
rearrange.
can't do Tuesday.
Okay.
Wednesday's good.
Okay.
And I'm a 50-50 in terms of, because I've
Okay.
I got to come out from out of town. So, you
Oh.
know, I can't gauge whether or not I'll be back.
Brittany, I'm sorry, I got lost the connection. What was decided about the next meeting time and date?
We're discussing Wednesday at 5 now.
I would not be able to do Wednesday.
Okay, Karen is a no, Paul is maybe no.
Is there an option to do like early in the morning? Like, does that work for people?
On Tuesday, it could for me.
Like 8 o'clock or,
I got a real job.
okay, yeah,
That's where I'm at 8 o'clock.
okay.
That's where I'm at. 8 o'clock.
Okay, and do people have lunch breaks? I'm just, yeah, okay, this is gonna be hard. Yeah.
Well, I mean, can we complete what we need to do by May 1st if we were to meet the following week? The week of the 27th? I mean, like, would that be what we need to do to turn in and kind of close the books on this?
Yeah, so we would just need to review our we would need to come prepared to have a deliberation and vote on that at that meeting.
Well, an extra week lets us think about it more.
It's true. Yeah. That works. Karen, yes.
I wonder if there's a process by which us, a subgroup of us takes all the recommendations and sort of like starts off with like, everybody said yes to these three.
Yeah.
You know, some way to help us grind through the bringing together of all the recommendations. My guess is that there's gonna be, we know there's at least one no-brainer, which is Jason's strategy, right? So we got that, and there may be others that people feel, you know, maybe we don't exactly align on the number amount, but we all are in favor of it. So just a thought as a way to get.
Yeah, because there may be some things that won't require significant deliberation.
That sounds great to me. I'm for that. Yes, Dawn.
I was just going to say, based on prior experience, I'm not feeling confident with a subgroup. So I think we just need to thug it out as a group, all in the same room, based on prior experience.
Okay.
So I'm proposing on Tuesday, April 28th, 5 o'clock.
That works for me. Is there anyone for whom that does not work? Tuesday, April.
I'm in clinic on Tuesday night, unfortunately.
Oh,
Okay.
Sorry.
It's all right. The 29th?
The 29th at 5, that'd be Wednesday.
I'm unable to do any Wednesdays. I've
No
got
Wednesdays.
childcare.
Monday, the 27th?
That works for me.
Okay.
Works for me.
Okay. So we'll have, does it work for everyone, I think? We'll meet again on Monday, the 27th at 5 o'clock, and then the deadline to complete the form.
I'm sorry, Monday, the 27th is the Durham County Volunteer Ceremony. Commissioner Jacobs, just throwing it out there.
Thank you for reminding me.
Yeah. And I'll be there too, so.
Okay, what about Thursday of that week?
The 30th of April.
Oh,
So
no,
that's
wait.
the day before.
Okay.
Go ahead.
No, I just realized I have another meeting. Durham joins together.
Right.
Yeah, and I won't be available the 30th either, so.
So where are we with the Tuesday, Wednesday again? It seems like Jamie can't do Tuesday, Karen can't do Wednesday.
I think
We
we're
do
going to be forced.
later, maybe like 7 to 8:30 or something like that one day. I don't know if that makes it more flexible for people on one of the days we already talked about.
I could do later.
Later works for me.
I'm just going to quickly look at my calendar.
Later works for me, except Wednesdays, because
Wednesdays.
baby don't go to bed till 9. So
I think.
Oh, goodness. Oh, go ahead. When Commissioner.
Yeah, I could move my schedule around for either Tuesday or Wednesday, whichever works best for people.
Dr. Carter, would Tuesday later work for you? Are you still in?
I'll be here till 8, unfortunately.
Okay.
Could do after that, but maybe a little.
What about Wednesday at 7?
It sounds like Karen can't be there. She's not free till 9 on Wednesdays.
And lunchtime's not good for anybody on any day.
lunchtimes would work for me.
I could do a lunchtime.
Dawn, what about you?
It depends on the day because generally I have meetings during lunchtime, so it just depends on which day.
Which day would be good for you for lunchtime?
It would have to be, if we're talking about that week of the 27th, it would have to be either Monday or Tuesday because I'm in a hearing Wednesday.
Okay.
Well, I missed that. What did Dawn say?
Monday or Tuesday, the 27th or 28th at lunchtime.
Those work for me.
I
Right?
I'm
think
good.
I think Monday would be better for me. I think I have a conflict on Tuesday.
Okay. Dr. Carter, some folks are good. All right. Committee sounds good. So a motion to, I guess, recess and reconvene Monday, April 27th at, what's our lunchtime? Noon? 12:30?
Dawn, what time is good for you for that?
I can do 12:30.
Okay.
And just to clarify, this will be an extension of the meeting that has been ongoing since last week.
Well, then I guess that is a good question. Do we just want to, what is easiest? Is it easiest to,
Well, I think if this meeting is in progress and it continues over, then the notice that you gave originally for the first meeting is still sufficient. I think if
Okay.
you're going to call this a special meeting, then you might run into notice issues.
okay.
And this was what was on the original agenda for the meeting last week anyway.
Yes. Okay. So we'll recess and reconvene. I would move to do that. Is there a second?
A second.
Okay. And then, so let's take the vote. Please vote when I say your name, Commissioner Jacobs.
Yes.
Dawn,
Yes.
Karen,
Yes.
Paul,
Yes.
and I vote yes, Dr. Carter,
Yes.
Shalisa.
Yes.
Okay. Beautiful. Okay. Motion. Okay, so we've done that. We're done. We've recessed. Thanks, everyone. Sounds good.
Good job. Good job facilitating.
Ooh-wee.
Yeah.
Yeah,
Yes.
thanks, y'all.
Thank
And
you.
Good
thank you for coming prepared for all those answers. Thank you for that.
Yeah,
Yes,
truly.
thank
Thank
you.
you so much. Awesome.
Bye.
Just let us know when we need to do our work by
Okay.
meeting.
Yeah, a deadline for that. Thank you.
Yeah, definitely.
Thank you, everyone.
We'll confirm.
Bye. Good night.
Good night.
Good night.
Thanks, everyone. Good night.